Ako, favorite ko pa naman. Shucks. Okay, sige.
Na-move daw to sa...
Oh my gosh, really? Kinsa
Ay naman to poll, sir, if ipamove ba na mo ang exam or dili.
Alright, tapos sa may answer, daghang ganana. I-move? Of course.
Wala pa'y balita, sir, pero per block man to ga-voting niya. Sa mong block kayo.
Go! I-move natin.
Nagpa-move
Joke.
niya.
Okay, sige. Alright, thank you for that, Earl. Sige. At least mag-gauge na ko ato ang pag-lecture. Sige, hopefully. Alright, so, nalimot ko sa mga ingon. Ayan, so, welcome to our lecture for today, dears. Ayan, so medyo lively ko karon. Last week, I'm so drained. So, medyo wala ko energy last Wednesday, so pasensya. But karon medyo okay na. Karon na po na Wednesday, basin maluya na po ko. So, adjust na lang tayo sa akong mood, dear. Sorry, medyo moody ako. So, epekto na ni sa pagka-single. Joke lang. Anyway, all right. So, again, welcome to our continuation on our discussion on nematodes, no? So, for the previous days, actually sa previous week, naka-start na tag nematodes and medyo dagan na chika sa nematodes, no? So, we're done with the intestinal nematodes and also we have began with your tissue nematodes, di ba? So, recall, kinsa itong na-discuss, katong na ay barber spool appearance and causes eosinophilic meningoencephalitis. Basta gani, kinsa to siya? Press the buzzer. You have? Hala, ang dali nyo makalimot, ha? Last week lang yun.
Angiostronchulus cantonensis.
Okay, very good. Angiostronchulus cantonensis. Don't forget, dear, basta ka na gani, barber spool appearance, eosinophilic meningoencephalitis, naku, press the buzzer na. Wala nang iba, you have Angiostronchulus cantonensis. Okay. Tapos, kinsa man tong ang pain daw na mo ma-feel kay similar to the pain manifested in appendicitis or pareha sa pain nagibulagan ka. Charot, joke. Similar to appendicitis, kinsa to siya?
Angiostronchulus costa-ricensis.
Okay, sige, very good. Angiostronchulus pa rin. Angiostronchulus costa-ricensis. Okay, alright, ayan. Sige, so munta siya itong mga na-chika last week. Causes the greatest increase, basta greatest increase in eosinophils. Kinsa ganito?
Trichidella spiralis.
Okay, very good. Trichinella spiralis. Okay. So now we'll continue with your tissue nematodes and siguro makatarta with your your blood nematodes after. Sige. So atong last na discussion was Angiostronchulus, di ba? Na mga species. Kani atong pinaka-last. Alright. Si Angiostronchulus costa-ricensis. So ako na siyang ginani dear sa kay para makabalo ko if na-disconnect ba ko. Okay? And if na-quit na ma-choppy ko or like ma-disrupt akong connection, please inform me. Okay? Alright, sige. So, we'll continue. We'll start first with yan, of course, Dracunculus medinensis. Ayan, so nigawas niya sa quiz bowl. Maragano niya siya, last question sa difficult round, if wala ko na sa'yo. And then ang question kay, what is the treatment? So, na-shook ko. So, shucks, wala pa binabot ani, but thankfully, naka-chaktura silang Earl. So, ang galing. Okay, anyway, ayan, so, Dracunculus medinensis, no? So, it's still a tissue nematode, and it's considered to be the longest nematode of man. Kinsa kanitong kinsa gi-consider na largest nematode affecting man?
Ascaris.
Okay, Ascaris lumbricoides. Iba naman ang pa-answer natin. Grabe na gyud. Okay. Iba dyan, answer din naman kayo. Okay? All right, sige. So, Dracunculus medinensis, longest nematode that affects man. And then we have here a very important characteristic, which is again a recall pud sa boards. All right? Gibutang ni siya na description. This worm consists of a thick cuticle and a large uterus that fills the body cavity and contains rhabditoid larva. So kana pa lang daan, okay? Kana description ha, kana description. Take note. Ang uterus daw niya puno na dayon og larva, okay? And na siya thick cuticle, kinsa na siya? Dracunculus medinensis. Okay, so later on, paglantaw sa iyang life cycle, ug unsang buhaton, mas mag-gets din nyo, okay? Alright, kung anong na siya uterus na dako kaayo, char. So uterus, again, that is filled with a lot of rhabditoid or L1 larva. Presabazio, kakinsa ni siya? Dracunculus medinensis. Okay, now we go to your common name. Common name is your guinea worm, all right? Fiery serpent of the Israelites. You have the Medina worm, dragon worm, and serpent worm. So guinea worm siya because it was named by an explorer from a place or sa coast, sa area sa mga Africa dapit. Okay? So na Guinea na place dito. That's why it's called Guinea worm. And aside from that, fiery serpents of the Israelites. So it was postulated or it was thought to be the fiery serpent na experience ng mga Israelites, 'di ba? Sa Bible, if you're familiar, no? Ayan. So siya daw ang fiery serpent of Israelites because again, this worm is quite common during that time, especially sa Egypt dapit, no? And sa Romans and even sa Greeks na mga time, no? So dugay na po siya na disease actually, no? So olden times pa lang na siya. Okay? So muna siya, it is discovered or it is postulated that this is the fiery serpent of the Israelites daw. Okay, all right. Now habitat, please take note, it resides in your subcutaneous tissue, all right? And it causes your dracunculiasis, all right? Intermediate host, the intermediate host are your cyclops, all right? Cyclops or your aquatic crustacean or water fleas, all right? Water fleas, F-L-E-A-S, water fleas, all right? Ayan. So these are mga gagmay na organisms, no? Sa imuhang water, usually fresh water, okay? All right. Now, infective stage is filariform larva pa din, L3. And the mode of transmission is usually through drinking, no? Drinking contaminated water that contains the copepods, all right? Copepods or cyclops or your water fleas, all right? So that's the important stuff about Dracunculus medinensis. Okay, now we go now to the life cycle. Now your life cycle again happens, all right, when the person drinks contaminated water that contains the cyclops, all right? Cyclops or copepods, no? So inside the copepods, again, if they're infected with filariform larva, once makaon na siya sa patient, all right, or once mainom, all right, the larva again will be digested, all right? And then mo penetrate sa wall, and then mo ato sa subcutaneous tissues kung asa siya mo mature, all right? Now, once they mature, all right, of course, magmate ang male and female, and then, of course, the female becomes gravid. And di ba, when you say gravid, ang point na kay buros na siya, all right? It contains already eggs, all right? And after, mo migrate siya, no? Is to the lower extremities, usually sa feet, all right? And mo form siya og ulcer, all right? Mo form siya og ulcer, and then once the feet is submerged in water, ang ulcer kay mo burst, okay? Mo burst ang ulcer, mo open ang ulcer, and then mo gawas ang worm, and then iyahang i-dispose ang mga larva sa water balik, okay? So, very important lang sa Dracunculus is that Dracunculus medinensis, wala siya egg stage, no? So, ang iyahang anak kay mga larva agad-agad, alright? So, same siya with Trichinella spiralis, alright? So, again, female buros, no? Uterus is filled, di ba, with rhabditoid larva, alright? And then mo migrate siya usually padulong sa tiil, and then mo form siya og ulcer, okay? Mo form siya og ulcer. Now, in humans, if sa humans na tayo ulcer sa tiil, pag submerge nato ana sa water, alright? Mo burst ang ulcer, alright? And mo gawas ang uterus sa worm. Ayan. Mo gawas ang uterus sa worm na puno og mga rhabditoid larva. And iyan ang i-dispense or iyan ang i-dispose sa water, alright? And the cycle goes on upon. Okay, so that's for the life cycle of Dracunculus medinensis. Okay, so na water involvement good. All right, okay. So here's an example of your cyclops, no, na copepod. As you can see, ano siyang cyclops because again, you have there a large eye kanina sa tunga. All right, it could be red or black, no. So that's why it's called cyclops. If you're familiar with Greek mythology, diba, cyclops are monsters that usually have one eye, one big eye at the center of their body, all right, or sa ilang face, at the center of the body, at their face, no? Okay, ayan. So, muna siya, cyclops. That's why it's called cyclops, all right. So, this is water fleas, ayan, mga copepods. So, silang intermediate host, simuhang Dracunculus medinensis. Excuse me. All right, okay. Now, we go now to your symptoms and pathology. As we have mentioned, di ba, again, mode of transmission is ingestion of water or drinking contaminated water that contains copepods, all right? Now, once the copepods are digested again, the larva will be free and the larva will penetrate the intestinal wall and migrate sa subcutaneous tissue, no? And sa subcutaneous tissue, dito sila mature, all right? And once they are gravid, the females kay buros na, all right? Migrate imuhang migrate imong female, all right, in your subcutaneous tissues. And then mo adto siya sa usually sa tiil, and then mo form siya again og blister inani, all right? Now, several hours before blister formation, the patient may exhibit mga systemic reactions like allergic reactions ba siya, vomiting, rash, pruritus magkatol because again the worm is moving throughout the subcutaneous tissues, and once this erupts, once mo erupt ni siya or mo buros mo gawas na siya, all right, then mawala na po ang symptoms, all right, because in a way pag open sa ulcer, na discharge tong larva and mga worm metabolites. Alright. Now, this only goes out, or kani siya kay maano lang, kanon sa tawag na, mu-burst ra siya if the foot, no, the foot is immersed in water. Okay? So, ang water ang mo-trigger para sa worm na mugawas, no, or para mubuslot ng ulcer. Okay? Alright. Because again, this infection is quite common in Africa, India, and where naa sila yung mga what we call step wells, all right, step wells, all right. So kanin sila kay mura sila mga kanang structures that contain water, all right, na murag manaog pa ka, submerge pa ka sa water para either maligo or para pod dito ka mukuha og ilim nun, drinking water nimo, all right. So very conducive, di ba, for dracunculus, because again your dracunculus happens in the water, di ba, sa copepods man siya, and di ba mo facilitate ang pag-erupt sa ulcer or mo erupt ang ulcer if in contact ang imuhang foot in water. All right? So mga step wells. Ayan, step wells. What are you doing, step wells? Step bro pa rin. So step wells. Ayan. So, ayan. So again, basta gani ang foot, kani siya, ang foot na nay ulcer, ma-contact in water, dito pa lang mo erupt or mugawas ang worm. Okay? And mugawas tong gravid na female dracunculus worm, yang ipagawas yung uterus, no? Na again contains a lot of larva. And then mubuslot ang uterus, mugawas ang larva to the water. And then the cycle goes on upon. Okay? So inana ang cycle sa Dracunculus medinensis. So na ay ulcer formation. Ayan, okay. All right. Now for usually for ano ba ni diagnosis na part? I think wala ra. I think na-delete na ko dear. Teka lang. Wait lang. Let me check. Ay, sa'yo. Sorry, wait lang ha. Teka lang. Teka lang. Wala rin. Okay, sige. Nag-overthink si ako. Charot. Okay, sige. Sorry. Percent. Hi, Lori. Good morning. Charot. Nung oras na. Charot. Check na. Okay, go lang. Alright. Sige, so wala rin siya. So we go now to diagnosis and actually also treatment. Usually, the diagnosis is mugawas ang worm, no? Mugawas ang worm from the ulcer. And here is an example, no? Here's an example of the worm na nigawas sa ulcer. And usually, that is also the mode of treatment. So you can see, akong gibutang dali, based sa CDC po and other references, ang ilan yung dimension kay no treatment, removal only. Alright? So, sige, ito na i-discuss. So, no treatment, removal only. And how do we remove that? We use a stick. Ayan, we use a stick. And using the stick, ato siyang i-carefully wound up or atong i-carefully i-twist, no? Ang worm until magawas siya or until the worm goes out. Okay? Alright, so the worm is slowly retracted in the stick, alright, by gradually turning the stick until matangtang ang worm. Now, very important that the worm that you get is complete, no? Tanan jud sa worm, tanan sa adult worm, makuha nimo. Because if the worm gets broken or damaged during the removal, then it can cause mga allergic reactions or inflammatory reaction kay nabilin tong other part sa worm sa imong body. Okay? So, pag bilin niya, mo cause siya mga inflammatory reaction, okay, sa imong body. And aside from that, there could be secondary infections such as mga arthritis and synovitis depending on the site of lesion. All right. Now, take note again, di ba, kung gibutang diri, kay no treatment. Pero, na-siya treatment actually, pasensya. So, bang mga references. And muna siya question sa quiz bowl nilang Earl. What is the treatment of choice for dracunculus? And ang atong answer is metronidazole. Alright? Metronidazole or pwede pong thiabendazole. Okay? So, I think ang choices ato man kay metronidazole, mebendazole, mebendazole, something. So atong choices kay either metronidazole or thiabendazole. So ang nigawa sa ilaha kay metronidazole. So na-chapter na po sila. So very good. Ayan. So metronidazole ato ang treatment or thiabendazole. This metronidazole or thiabendazole will also can help, no? It can help in the removal of the worm using the stick para ma-prevent ang mga inflammatory reactions or para mas easy mo gawas ang worm. Okay? So two choices, metronidazole or thiabendazole. So paki-note na lang dyan sa inyong notes, no? Pasensya. Okay? Alright. But again, the main good nato na mode of removal is using a stick, and ato siyang ipatuyok sa stick until mo gawa siya. Alright? Okay. And because of that, procedure, di ba, it resembles daw the rod, kani siya na sa left, no, the rod of Asclepius, di ba? Usually, this is the symbol of medicine, ba? If I'm not mistaken. All right? So, you have the rod of Asclepius. Sa mga fan pa rin ng Greek mythology, Asclepius is a god of medicine, di ba? So, rod of Asclepius. So, there have been reports or diri daw gikan ang rod of Asclepius, no? So, usa ka snake na nasa rod, no, or kaning stick sa tunga. All right. Lahi po tong staff ni Caduceus, no? Caduceus, which is the staff of Hermes sa Greek mythology. So, ang daming Greek, no? So, ang Caduceus kay duha ka snake. Inani siya. Sorry, di ko makawalo mo drawing, nana. Duha ka snake na nagpalibot sa each other. That's the staff of Caduceus. Ay, na-Greek mythology ka, Jut. All right. Ayan, Caduceus, di ba? Staff of Caduceus. Caduceus, ayan. So, there have been postulates, all right, or ilang gi-think na possible that the rod of Asclepius kay gikan diri, all right? Possible sa ancient treatment nila na again pag kuha og stick and then ipa-insert o ipatuyok ang worm dito, no? So basin dira gikan ang rod of Asclepius, all right? So mga symbols of medicine, di ba? Okay, ayan. So that's for Dracunculus medinensis. Now in the 1980s, usually mga early 1980s, a lot of people have been affected by this, no? Because again, it's usually common among those areas na walay safe water, no? And again, those that na mga structures such as step wells, no? So good from there, no? 1980s until mga early 2000s, there have been efforts to eradicate yun, no? A lot of efforts have been done, and thankfully, no? As of 2018 daw, according to CDC, global eradication yun is within reach, no? So that's a very good milestone. Hopefully, muna siya goal, no? Hapit na yun daw ma-eliminate in the face of the world ang Dracunculus medinensis. So, they are hoping that this is the second disease to be eliminated. Unsa ditong first disease na na-eliminate sa face of the world? Unsa man to?
Smallpox.
Okay, very good. The smallpox, no? So, smallpox ang first, and kani si Dracunculiasis or Dracunculus ang ilahang gina-expect na musunod sa yapak ni smallpox na ma-eliminate from the face of the world and ma-eradicate. So hopefully, no? Again, so kaya naman siya because again, usually the main mode of transmission, diba, is contaminated water. So to prevent lang that, we can use filtering of water para mawala ang copepods, or also providing safe water to the people affected, no? So from there, daghang efforts na yun, and the efforts have produced great outcomes, and padulong na doon siya eradication. Global eradication yun. So, we'll continue to pray. Hopefully, mahurot na yun siya and mawala na yun ang Dracunculus. Okay? Alright, so that's for Dracunculus medinensis. Again, your guinea worm, fiery serpent of the Israelites, Medina worm, no? Ayan, serpent worm. Okay. So, again, Dracunculiasis causes is also known as your guinea worm disease. Alright? Ayan. So, guinea worm disease or Dracunculiasis. Alright, so that's for Dracunculus medinensis. Okay, alright, sige. So before we proceed to the next, any questions, any clarifications there? Ikutasan ko. Alright, okay, sige. Dracunculus. Yes? Ito man to. Yes,
Sir,
then.
what if maputol, sir, nag-remove mo? Unsa ang patient?
Ayun, there will be inflammatory reactions. Possible na manghubag ang sa tiil, alright, or naabay mga allergic reactions na mahitabo. Because again, pag putol nimo, mabilin tong other parts sa worm that contains mga metabolites, alright, na possible po na ma-express sa surrounding tissues, which could lead to, again, inflammation. Ayan, so it's best na lang to, if you remove siya, dapat slowly yun para matangtang tanan, right? So if mabilin, then tambalan na to mga inflammatory reactions like mga corticosteroids, no, para mawala ang inflammation. Okay, and then siguro surgery to remove the remaining parts na nabilin sa worm, na nabilin sa body. Okay, so it's best good na kailangan siya slowly, no? Kay mo dugo, charot. Slowly. Okay, all right, sige. Any questions aside from that?
Wala yung possibility, sir, na mahimong necrotizing fasciitis ang patient sa iyang tiil.
Not necessarily din naman because your worm in a way doesn't have, as far as I know, wala sila enzyme similar to those bacteria, no, that can exhibit necrotizing fasciitis kay mamatay ang tissue. Siguro if dili lang maagapan dayon or matangtang tong mga metabolites, possible, no, but there have been no reports usually of necrotizing fasciitis with Dracunculus. So and less naman po ng cases karon worldwide sa Dracunculus. And eradication is within reach, hopefully. Ayan. But again, wala kayo reports of necrotizing fasciitis with Dracunculus. Yeah. Sige. Any more questions? Okay. Yes, Earl. Ang daming chika ha.
Sir, mulay na siya, ay, mulay na siya larvae daan sa ulcer or pag-contact na sa water o sa pagawas ng larvae?
Yeah. So, sa sulod sa uterus, di ba, remember yung distinct characteristic is the uterus is already filled with rhabditoid larva. Sa ulcer pa lang daan, muto siyang mo-ulcerate kay murag na dito ang worm, nag-wait na lang siya. Okay? Pero inside the ulcer, wala pa siya nag-lay og larva. Okay? Pag contact pa lang sa foot, especially sa foot, sa water, mu-erupt tong ulcer, and then ang worm, iyang ipaggawas iyang uterus, which is full of larva, and then the larva will go out of the uterus. Di ba? Padulong sa water para na po ma-complete ang life cycle. Kaya ang larva na iyang gi-produce sa water, kano na po copepad and all that. So, para the life cycle goes on. Okay? Pero inside the ulcer, wala pa yung larva dito. Okay? Di pa siya mo-produce ng larva. Pag contact lang sa water, mo-erupt ang ulcer, mo gawas ang uterus, then dito mo swim or mo gawas ang mga larva sa water. Okay? Alright. Sige. Any shucks. Any questions? Alright. Okay? Sige. Okay na? Alright. Sige. I hope na-answer ato mga questions, ha? Okay, sige. So we'll continue to the next tissue nematode, and that is your Toxocara. Now, your Toxocara species, again, these are the Ascaris worms of your dogs and cats, no? So Toxocara canis, nasa pangalan na, is the dog ascarid or the dog roundworm. And for Toxocara cati, cat, nasa pangalan na, so siya ang sa cats, cat ascarid and siya, or cat roundworm. So this is the Ascaris, okay, na equivalent to your cats and dogs, okay. Now, accidental host siya kita, man. Infective stage, same with your Ascaris, but it's embryonated eggs. Okay. Now, mode of transmission, the main mode of transmission is ingestion of the ova, especially the ova from the environment. No, accidentally lang yun. Aside from that, we can also get it from undercooked meat or viscera of infected paratenic host. Those that have eaten mga possible contaminated foods sa mga environment with dog or cat feces, such as beef, lamb, chicken, duck meat, no, especially liver. But kanina na mode is not quite common. The main primary mode of transmission good is through ingestion of infective eggs from the environment accidentally. Okay? All right. So that's for the initial information about Toxocara. Okay. Now for Toxocara, excuse me, the life cycle again is quite similar again with your Ascaris lumbricoides, no? So we get it from eggs. But again, we are accidental lang. All right? Accidentally lang yun. The main definitive host are your dogs and cats. Now, the dogs and cats, kato mga mama, all right, they can transmit the larva of your Toxocara to their puppies and kittens, no, respectively. So, pwede nilang ma-transmit through the milk, lactogenically, or pwedeng vertical transmission. So, ang dog, katong Toxocara canis, kaya pwede siya through milk or pwedeng vertical transmission, transplacental. But for cats, usually it's through milk lang, lactogenically. Walay vertical transmission sa cats, okay, to the kittens. Alright? So, kanap lang daan, no, possible good na ma-transmit na siya to the babies. So, possible na mas daghang ma-infect and mas as early as the puppies and kittens, no, na sila infection daan. Alright? So, same ra gyapon, malibang sila sa environment, okay? Makaon sa uban, accidentally, ang egg, and then the cycle goes on. All right. Now, in humans lang, very important, in humans, when we eat the eggs, kung makaon na to ang egg sa Toxocara, the eggs or the larva inside the eggs will not mature into adults. Okay? So, di siya mo mature into adults. So, ano lang ta? Dead-end host, di ba? Mga aberrant? Tama ba? Nalimot ako sa mga terms na to. But again, the point is, again, hindi siya mature into adults. And this larva, these larvae of your Toxocara, siya ang migrate. Ayan, siya ang maglaag-laag to other areas of your body. And ayan, very important, it causes your visceral larva migrants and ocular larva migrants. All right. So starting first with VLM, visceral, of course, that's ang pangalan na, visceral. It's the larva of your Toxocara that moves and migrates along and around, no, tanang organs in your body. Okay. And because of that, no, it can cause inflammation, inflammatory response, in your areas na iyang giadtuan, no. Wheezing is a common sign. So example, sa lungs, if mabot siya sa lungs, na wheezing. All right. And liver enlargement and necrosis may also occur, and the heart can also be affected, but it's less common. All right. So that's visceral larva migrants. Sa pangalan na, visceral, no. Within the organs, there are larvae that are migrating, no. So naglihok-lihok from the intestine, ni spread siya to the other organs. All right. And it causes inflammation sa mga organs na nadtuan. All right. So that's for VLM, visceral larva migrants. Next is OLM, no? Ocular larva migrants, sa pangalan na. So, maabot siya sa eyes, all right? And this is usually seen in children 5 to 10 years old, all right? And usually, this is a result lang of a very few larvae na naabot sa eyes. Now, if dili siya maagapan or magpadayon siya, the most serious complication is, of course, invasion with the retina. Blindness is also common, all right? So, pwede siya magka-proceed to blindness, all right? Toxocara, ocular larva migrants. Okay. Next, you have also covert toxocariasis or cotox. Okay, plural sa mga kuto. Chakara. Less specific syndrome in which the patient remains asymptomatic and there is less eosinophilia. So, wala rin na-feel ang patient, alright, pero naasay larva na nag-migrate inside. So, covert toxocariasis. Alright. Now, neurological toxocarisses, ang larva mabot sa brain. Okay. But again, that's not common. Pero once mabot siya sa brain, of course, that can be life-threatening. Okay. Now, the most outstanding feature is high peripheral eosinophilia, which can lead up to 90%. So don't be confused. It can cause high peripheral eosinophilia pa rin. Pero, if ang question pa rin is kinsa jutong worm na makakause o greatest increase in eosinophilia, ang answer dyan po na kay Trichinella. Okay? Daghang other worms actually in helminths that can cause eosinophilia, but si Trichinella yun ang intense ang makos. Okay? Toxocara is one of them, na mga helminths na makakos Japon og high peripheral eosinophilia that can reach up to 90%. All right? Okay. So, as you can see, VLM, OLM, actually, there are also other helminths, okay, that causes VLM and OLM, di ba? Example, cutaneous larva migrants. Again, kisa ganito makakos sa cutaneous larva migrants or creeping eruptions. Kisa ganito? Nalimtan na. See?
Ancylostoma.
Okay, Ancylostoma, kinsa man na species? Your?
Caninum.
Alright. The animal hookworm gyapon. So Ancylostoma brasiliense, the cat, and Ancylostoma caninum, the dog. No, so same gyapon sa Toxocara. It's the animal na Toxocara ang maka larva migrants. So aside from Toxocara, dapay lain yung helminths na makakause og visceral and ocular larva migrants. Okay? Meaning ilang larva na abot sa brain, abot sa ubang organs. But si Toxocara ang pinaka-common yun that can cause visceral larva migrants and ocular larva migrants. Okay? So siya gyud, no? Siya gyud. So if na mga question na this causes visceral larva migrants, press the buzzer. Atong answer ana kay Toxocara. Okay? So how do we remember? Kinsa may nakakause og visceral and cutaneous larva migrants, diba? So Toxocara, cara, no? And then visceral, diba? So si Vice, ganda, visceral man na siya. Vice, diba? Visceral. Na siya kanta na boom karakaraka, o diba? So visceral, boom karakaraka, it's caused by Toxocara. Okay? So do not be confused between Toxocara and Toxoplasma. Okay? Your Toxoplasma, diba, is a sporozoan. Alright? Makuha Japon sa cats ang Toxoplasma, di ba? Alright? It can also involve the brain and also the eyes. But take note that Toxoplasma is a protozoa. Okay? It is a protozoa. Whereas your Toxocara, okay, your Toxocara is a nematode. It's a worm. Okay? Don't be confused. Don't be confused. Okay? And again, how do we remember? Visceral, di ba? Vice ganda. Nasa kanta na boom karakaraka. Okay? So, visceral, Toxocara, boom karakaraka. Okay? Mnemonics natin yarn. Okay? Don't forget. Boom karakaraka, bias ganda, visceral larva migrants. Okay? So visceral larva migrants, the Toxocara species. And then you also have cutaneous larva migrants, creeping eruptions. Don't forget the Ancylostoma brasiliense, Ancylostoma caninum, animal hookworm. Okay? All right. Now, usually when we recover Toxocara, dili na siya kailangan i-specify yun into like if it is Toxocara canis or Toxocara cati. Most of the time it's from the dogs, no, Toxocara canis. But if you want to differentiate the two, of course, pwede kang mag-molecular methods, alright? Para ma-speciate yun, okay? Because the eggs of the two are quite similar, okay? They look the same, alright? Sige. Now, for lab DX, of course, the definitive diagnosis is detection of larva, alright? From tissue. But because, again, this is quite invasive and difficult to perform, it's not recommended, okay? Pero dira ta makakita dito sa larva sa imuhang tissues, okay? The eggs, of course, kaniyang eggs, dili siya makitaan sa humans because again, of course, the Toxocara species do not mature into adults. So this nakaproduce og eggs, di ba? Putubras lag larva, alright? So kaniyang mga eggs, makita niyo siya sa imuhang dogs and sa imuhang cats, okay? So these are the eggs of Toxocara, di ba? Similar po siya appearance sa imong Ascaris. So the Ascarid worms usually na mga family, same na good appearance silang eggs. Okay? Alright, ayan. So, ato ang main mode is serological test. No, that it's recommended. And enzyme immunoassay ato ang main test of choice. And ang titer na 1:32 is diagnostic for VLM and 1:8 is diagnostic for OLM. Now, as you can see, di ba, ang titer sa imong OLM is quite low lang, no? So, in a way, it signifies na medyo gamay ra pod ang mga larva na involved. Compared sa imong VLM na medyo higher ang titer, it's because mas daghang larva ang na-involve sa imong pag-migrate to the other organs. Okay? So 1:32 ang titer na diagnostic for VLM, 1:8 ang for OLM. Now, treatment, wala na ako nabutang dira, dears, is still the azole, okay? Albendazole. And we can also perform photocoagulation. So once sa eyes na siya. So when you say photocoagulation, ang imuhang eyes, paagian siya laser, alright? A laser will be pointed into your eyes para ma-destroy itong mga larva inside your retina, okay? So photocoagulation, right? For the treatment of choice pa is albendazole, alright? So that's for Toxocara species. What we have to remember lang, again, very important, causes visceral larva migrants and ocular larva migrants, okay? Visceral, no? Diba? Atong mnemonics again, virus ganda, visceral, causes, boom karakaraka, causes, boom karakaraka, Toxocara, causes visceral larva migrants. Don't forget that, ha, mnemonics. Very helpful. It really, di ba, ni-stick siya to me until now. Okay? All right. Pero kung question kay cutaneous larva migrants or creeping eruptions, atong answer is, of course, Ancylostoma Ancylostoma brasiliense and Ancylostoma canino. All right? Don't forget. Okay, so that's for Toxocara. Don't be confused, ha, with Toxocara and Toxoplasma. Lahi na sila. Okay? All right. So that's for Toxocara species, your dog and cat Ascaris. Okay. Any questions? I hope effective ito na mnemonic, ha? Okay, sayang ang 1 point. Okay. All right. Sige. So again, don't forget, ha, the Toxocara do not mature into adults inside the body, only larva lang. Okay. Sige. All right. Any questions? Okay, sige. So we now continue to the next tissue nematode, and that is your Anisakis Simplex. No? So Anisakis Simplex is actually one of the worms that causes the disease Anasakis. All right? So ang Anasakis, daghang kayong worms na nag-cause ana. All right? And Anisakis Simplex ang one of that. So mo to siya i-focus karon. No? So Anisakis Simplex is considered to be the fish and marine mammals roundworm. So kapamilyar yapon siya sa imuhang Ascaris, all right? And it causes what we call herring disease, and it's common in Japan. Ayan, so sa mga Japan, okay? Now, common names, again, herring worm, cod worm, seal worm. Definitive hosts are your whales and dolphins. First intermediate hosts pa rin are copepods para sa imuhang Dracunculus. Now, these copepods, of course, will be eaten by smaller fishes, all right? And then these smaller fishes will then be eaten by your larger fishes, and sa larger fishes na to makuha ang infection, all right? Now, mode of transmission is ingestion of raw, all right? Raw, pickled, salted, smoked, freshwater fish infected with larva, all right? Pwede po, aside from fish, pwedeng squid, all right? So, ang fish na involved ani kay marine fishes, okay? Dili katong freshwater. So, marine fishes. Ang Capillaria philippinensis, freshwater na mga fish, all right? But for Anisakis, marine, katong makuha agad sa dagat, okay? All right, so, infective stage is the filariform larva that is found in the muscles of the fish or pwede po sa internal organs sa imuhang fish, okay? So, how do we get it? If we ingest raw, no? Or undercooked, pickled, salted, or smoked na freshwater fish. Example of that kay salmon, no? Salmon. All right, salmon, because again, this is used in mga sashimi and sushi. That's why it's common in Japan because in those areas, di ba, common ang sushi and sashimi in which ilang ginakaon ng fish as raw. Okay, so yeah, so that's Anisakis Simplex. Okay, now we go now to the life cycle. As you can see, again, di ba, ang mga dolphins and imuhang seals, ang imuhang definitive host, so sila yung produce sa eggs. And then the eggs will embryonate and mature in your water, in the sea, all right? And then, of course, it produces the larva, yung mait ang mait siya by the crustaceans or copepods, which is kanon na po sa imuhang mga smaller fishes and then sa bigger fishes. And once these bigger fishes are eaten again back by the dolphins and the seals, so mo complete ang life cycle. And again, pwede na itong makaon ang fish if, again, if raw or undercooked ang fish. And once eaten, the larva, all right, will not mature again into adults. May mura siyang larva dito sa imong intestine, all right? And it causes symptoms sa imong intestines, all right? Sa imong intestinal symptoms. Okay. That's for Anisakis. Anisakiasis. Again, as I've mentioned, Anisakiasis is caused by a lot of worms, no? Anisakis, Pseudoterranova, and Contrasico, all right? Pero ang atong gi-focus lang kay Anisakis Simplex. Kaya siya rin naman ang common. Okay. Now we go na to symptoms and pathology of Anisakis or Anisakiasis. So symptoms and pathology, of course, the first presentation is acute gastric presentation, especially after eating fish, no? After eating fish na undercooked such as sushi or sashimi, ayan, dito mo gawas imong mga symptoms. This is the most commonly recognized clinical syndrome. Next, you have intestinal anisakiasis, of course, acute symptoms or chronic presentation. And then, of course, usual vomiting, diarrhea, no, after eating undercooked or raw na mga fish. And then another one is what we call a tingling throat syndrome, usually common in North America. All right, and this is caused by one of the worms, again, that causes anisakiasis, your Pseudoterranova decipiens. So by the name itself, tingling throat, no, the patient can feel a worm moving in its throat, no? Ayan, and the patient can cough up the worm, pwede niyang maubo ang worm, mugawas ang worm, all right? So same siya with your Gongylonema pulchrum. Pero ang Gongylonema pulchrum usually sa mouth, no? There is a mouth. But for Pseudoterranova decipiens sa imong throat, no? Magkatuloy imong throat, pero naigalihok sa imong throat. Ay, yes, okay. All right. Sige, that's for tingling throat syndrome, again caused by Pseudoterranova decipiens. Okay. Now, Anasaki Simplex lang, take note, the larva can penetrate your gastrointestinal wall and can cause it can invade your abdominal cavity. Okay, but thankfully, di naman siya mo spread to other organs. But there have been reports, no, of spread siya sa other organs. But again, that's not common. Usually, sa abdominal cavity lang. Now, aside from that, because of that, there are also allergic reactions, no, in patients that have been sensitized already by this larva. So, common ang allergies, no, allergic reactions sa anisakiasis. Okay. Because again of mga metabolites sa worms, alright, and sa pag-migrate niya sa mong abdominal cavity. Okay, so it can cause allergic reactions. Again, same po, no? Nausea, vomiting after ingestion of your marine fish. Again, ang fish na involved kay mga marine fishes. Okay, alright. And there's only low-grade eosinophilia and a positive result for occult blood in the stool. Ayan, nako, occult blood. Nako, AUBF ulit. Okay? So because again, di ba, ma-penetrate man ang imuhang intestines, so there could be bleeding, pero dili na nakadaghan, no? So pag check sa stool, ayan, pag check sa stool, there could be, blood, pero ginagmay lang na amount. So muna mo positive siya sa occult blood. Okay? So again, di ba, occult blood is primarily used for detecting, di ba, or for screening, monitoring, unsa na disease na to. Ang occult blood. AUBF, kamusta? Occult blood, it's for ano man? Ano yung purpose sa occult blood? Na-disconnect ko. Okay, wala ka. Okay. Ano man? Where do we use this, ang occult blood man? For? Okay, cancer, no? For early, in a way, diagnosis or monitoring of colorectal cancer. Okay, don't forget that. So we'll talk more about that when we go to AUBF. Okay, ayan, sige. So again, there could be low-grade eosinophilia lang and positive occult blood sa stool. All right. So again, for diagnosis is usually presumptive is your patient's history. Okay, and the definitive identification is larval recovery or histologic examination of infected tissue. So usually, because again, these worms are attached on the intestine or in your stomach bar or sa intestine, pwede silang dili ma-recover sa stool. Okay? So we can see it through endoscopy na endoscopy, ayan, para sa ani, and they're attached on your intestinal wall, diba? So you can see, because they're attached, they can cause mga lesions, no? And there could be also bleeding ginagmay. All right? Okay. And of course, molecular methods. Now, here's a fish, pwede siya makita sa meat. All right? Okay. And that's why muna siya one of the studies unta na akong ganahang i-pursue, charot, or one of the topics na akong ganahang i-research sa una when I was a third-year student, no, Anisakis, to detect the prevalence of Anisakis worms sa mga fish here sa Duma, especially sa mga sushi restaurants, no? Like sa daghang mga Japanese restaurants na here, no? No offense, okay? Just want to check sa ilang fish kung nabay mga Anisakis na worms. Ayan. So, mga prevalence lang, pero wala na dayon. Okay. That's one of the studies that akong githink, and then ang second kay schistosomiasis. But again, wala siya na pursue. But maybe in the future, sige, let's do it. Charon. So, yan. And if you can see also, if you watch Cells at Work, no, sa Netflix, I think first season nila, na episode on Anisakis, di ba, kabantay mo ng Anisakis, yang gibuslutan ang stomach. Because again, pwede siya makabuslot og stomach because makapenetrate siya sa imuhang intestinal wall. Okay? Alright, ayan. And also, monsters inside me, nako, sige na akong promoting monsters inside me. There's also a case of Anisakis there. And ilahang gi-expose ang Anisakis to a lot of kanang environment. Let's say, ang fish daw na meat with Anisakis, expose siya to hot water on sa effect. If hot water, mamatay yun ang Anisakis. Kay makook man yun, no? If the fish is well cooked, mamatay ra yun ang worm. But let's say if lemon ra daw, like butanan mo siya lemon juice or suka, vinegar, which is common again in mga sushi or mga raw na mga fish, di ba? Na kanang kinilaw, mga inana lang na vinegar ra or lemon, dili mamatay ang worm. Like makalihok ra siya, maglihok-lihok Japon siya. Okay? So, inana siya ka resistant, charot, sa mga inana. But if i-cook ra gyud ang fish, then okay ra gyud. Alright? If it's well cooked, then wala ray problema. Because again, raw, undercooked, or pickled na mga fish, usually na to makuha ni siya. Okay? Alright, that's for Anisakis Simplex. Okay? Or Anisakiasis. Alright? What you have to take note lang again, undercooked fish, raw fish, can cause allergic reaction. Please take note, no? Allergic reactions in those that have been sensitized. Okay? Alright. Especially those sa siging kakaon ng sushi, no? Siging kakaon ng sashimi. So that's why it's common usually in sa Japan, no? Because sushi, sashimi is part of their staple food, no? So common good nila dito ang mga food na inana. Okay. Alright, sige. Sa in the Philippines, kay kita, maka sushi, sashimi lang kung bagong sweldo. Charot. Tsaka. Pero after the sweldo, wala na. Balik na sa sardinas and all that. Charot. Okay. Ayan, sige. So that's for Anisakis Simplex. Okay, sige. So before I proceed, any questions? So be careful mo, dear, ha, sa inyong mga gipangkaon as I've been telling you. Sa mga raw. Okay, charot. Ang sarap na raw. Charot. Okay. Any question? Okay. Alright, sige. So we proceed now to the last na gyud of the tissue nematodes, and that is your Balis ascaris prosayonis, no? So Balis ascaris prosayonis is, of course, common in raccoons. Ayan, nasa pangalan na. Common name is your raccoon roundworms. The definitive hosts are actually your raccoons or dogs. Accidental hosts like Japon man, and infective stage are still embryonated eggs. So mode of transmission, wala nang iba, accidental ingestion pa rin of the eggs from the environment. So those areas na common ng raccoons. So in the Philippines, I don't know lang, hindi ko sure, pero wala man kay raccoons dili. So common siya in the America, no, North America, and areas na ay raccoons, all right? So raccoon roundworm. So this is normally found in raccoons, okay, mga raccoons. Ayan. Okay. Now, it's still a family, part of the family gapon siya of Ascaris, no? Nasa pangalan na, Balis ascaris, all right? Now, the egg, as you can see, quite similar, pa rin with Ascaris. It's oval, dark brown, single-celled embryo, all right? Thick shell, finely granular surface. Same siya with Ascaris na it's not infective immediately pagpas. So, may embryonate pa siya sa soil within how many days, all right? But it can survive in moist soil for years. And here's a GIF or GIF of a larva. Ayan, larva inside. So, L3 larva na siya. O, diba? Nagalihok inside the egg of your Balis ascaris prosayonis. Okay. Now, we go now to the life cycle. Of course, raccoons, dira mo makomplete ang life cycle. So again, raccoons, malibang sila, all right, sa environment. Okay, the eggs this time, again, can be then caused or can be acquired by pwedeng mga rats, okay, because sa environment pwede nilang makuha. And of course, sa humans, all right? Pwede natin siyang makuha accidentally, ingestion of infective eggs from the environment, okay? Now, dogs, pwede po, possibly, pero rare lang siya, all right? Because again, pwede siya ma-expose sa environment, makakaon siya anything dito na contaminated with raccoons. But raccoons, yun ang main host, no? All right. The rest, usually mga accidental or mga paratenic hosts. Okay. All right. Now, for humans, symptoms and pathology, very important lang, similar siya with your Toxocara, same siya. Now, once makaon ng eggs, okay, the larva will hatch out of the eggs and the larva will not mature into adults, okay? They will not develop into adults, but similar, very similar to your Toxocara, they will migrate to other organs of the body. Ang difference lang is, ang organ na yung ganahan is sa brain. Dito gid siya mo migrate. Okay? So it causes visceral larva migrants, as I've mentioned, di ba? Aside from Toxocara, napag-lying helminths that can cause visceral larva migrants. Pero ang pinaka-common yung kay Toxocara. Alright? And aside from that, press the buzzer good or distinct for Bailey's ascaris is your neural larva migrants. Meaning, naabot ang larva sa imuhang brain. Alright? Now, aside from that, a difference, aside from causing neural larva migrants, your Bailey's ascaris larva also will continue to grow. Pero di siya may mong adults, alright? But dahil siya grow and vigorous iyang migratory behavior, meaning pwede pang other organs or daghan kayo siyang pwedeng maapektuhan. Okay? Alright. And magpadayon siya grow, pero di siya mahimong adults. In contrast, yung mga Toxocara and other species or other helminths that causes visceral larva migrants, the larva do not grow in size. Okay? Your Bailey's ascaris mo grow in size imuhang larva. Magpadayon siya po siya grow. Okay, pwede siya mabutog adult. Ayan. Okay. Now, patients can present with eosinophilic meningoencephalitis or unilateral neuroretinitis. Sumabot siya sa eyes. Pwede po siya sa brain, causes eosinophilic meningoencephalitis. So, it can cause eosinophilic meningoencephalitis, pero if ang question pa rin is eosinophilic meningoencephalitis, kinsa tong answer? C, Angiostrongylus pa rin. Okay? Angiostrongylus cantonensis. Okay? Alright, ayan. So, siya ang common, ang Angiostrongylus cantonensis. Si Bailey's ascaris, second na siya. Second option. Charet. Okay? So, eosinophilic meningoencephalitis. And sa eyes, unilateral neuroretinitis. Okay. Alright. Now, NLM, which is distinct or common or a feature good of Bailey's ascaris, again, neural larva migrants. The larva, again, will enter sa CNS after mga 1 to 4 weeks, and the disease may progress very rapidly. So it's usually found in infants and young children, and the symptoms, of course, they can present with neurological symptoms, seizure, convulsions, ataxia, coma, and even possible death. Okay? Ganun common siya sa children and infants because again, di ba, these people or these children and infants, usually magdula-dula sila sa soil, di ba? Samot na if they're still children, wala kabalo kung unsay mga possible makuha, no? And let's say wala pa sila gitunluan ng proper hand hygiene and all that, so pwede pa silang magkaon-kaon, di ba? Usually, mga children or infants, di ba, magkaon man na sila o like sa dirt, di ba, diretso man na sila butang sa ilang kamot sa baba. So, sila yun ang pinaka-prone to this. But of course, aside from that, adults are also common. Adults can also be infected by this. Pero ang pinaka-common good are children and infants. Okay? So, NLM, no? Neural larva migrants. All right. And once in the brain, no, it can really cause severe damage. Okay? And if makasurvive man gani, no, those survivors are usually left with a lot of neurological deficits, meaning daghan na jud kaayong guba, no, silang brain, possible na di sila kalakaw, no, or possible na vegetative state na lang sila, like mag-bedridden na lang forever because again, severe ang damage na na-cause sa brain, okay? And usually the disease is diagnosed kanang severe damage na nahitabo sa brain, okay? All right, because the symptoms do not appear immediately, ganun, okay? So once naan na siya, ma-detect na siya, the brain is already damaged kaayo. So if na mga survivors, usually they are left with a lot of neurological deficits, no, like kanang di nakatindog, no, paralyzed na, mag-iso nagsturia, or vegetative state na lang yun siya, no, mag-bedridden na, ganun. Okay? Alright, ayan. Now, again, aside from NLM, di ba, it can cause OLM po. So, diffuse unilateral subacute neuroretinitis. So, there's progressive unilateral vision loss, so one eye, retinal pigmentation, optic nerve anatomy changes, and all leading to ocular damage, no? Which of course can lead to blindness if dili siya maagapan. All right? So that's for Bailey's ascaris prosayonis, no? So it's very deadly, no? Life-threatening po siya na nematode infection. But again, in the Philippines, dili kayo siya common. Okay, I think wala tayo raccoons, all right? But in the US and other areas na common ang raccoons, then this is a common disease, all right? not really common, pero medyo rare pa di ay. Rare pa ang na-reports, pero throughout time, no, medyo marami-rami na ang mga reports na produce. Because your raccoons, usually, they produce a lot of eggs, no, mga thousands of eggs yun in the environment, silang stool. Now, let's say again, na kay mga bata, mga children, infants na magkamang-kamang sa soil, no? And then, di ba, these infants usually diretso butang ilahang kamot, silang baba. So, di ba? So, very common, very prone good sila. Okay, all right, ayan. Now, for diagnosis, of course, tissue pa rin, identification of the larva in the tissues, but it can be difficult. You can use peripheral and CSF eosinophilia, all right? Okay, and serological test, very important, no? You have ELISA, Western blot on CSF. Now, for cures of B. procyonis, nakoy notes dali, there is no effective cure, all right? And usually, okay, all right. And usually, atong ginatambal lang kay mga corticosteroids to prevent inflammation or to suppress inflammation. And mga anti-helminthic therapy usually, dili daw responsive ang Baylis ascaris, no? Procyonis. So we have to monitor the patient, padayon nagyan po ng monitor, all right? But we can also use other anti-helminthic or other anti-parasitic na mga therapy, okay? All right, so that's for Baylis ascaris procyonis. So here's an example of your larva in the eye, Baylis ascaris, and in the tissue, in brain tissue. All right? So that's for Baylis ascaris procyonis. All right? Your raccoon roundworm. Okay. All right. So that's all for tissue nematodes. Yes. All right. Before we proceed to the next group and the last group na gyud of nematodes, do you have any questions? All right. Hapit na mo ng September. Oh my gosh. Wala lang, chika lang. Tomorrow kay is 21, the first day of our board exam, 2 years ago. 2 years ago. Oh! All right. Mga ano niya siya, contemplation. Mga existential crisis at 11 in the morning. Charot. Okay. Any questions here before we proceed to the last group na gyud and the last topic for today? All right. Sige. Alright, sige. Before we continue, again, kinsa itong maka-cause of visceral larva migrants, pinaka-common ha, pinaka-common na maka-cause of visceral larva migrants, see?
Toxocara.
Okay, your Toxocara species, okay? Toxocara species, di ba? Toxocara, atong mnemonics, si Vice Ganda, visceral, na siya na, bukraka. Okay, alright, sorry naman, I know corny siya, pero so Toxocara, because again, these worms can be transmitted by dogs and mga cats. So be careful jud mo kamo mga fur parents na may mga pets, no, na dogs and cats. Make sure you that these pets of yours are regularly dewormed, no, magsigis like deworming, no, up to date ilahang mga vaccination, up to date po ilahang mga veterinary visits and check-up para gyud ma-prevent, no, ang kanina mga infection. Because again, sila ang mga prone. And kita, if we take care of them, no, pwede po tayong ma-accidentally infect. No? Especially if naman mga children yun sa inyong balay, infants, no, babies. Alright? Ayan. And aside from that, the idea is, diba, cutaneous larva migrants is caused by your ancylostoma ng mga animal hookworm. Okay? Aside from that, these two species also can cause what we call Eosinophilic Enteritis. No? So by the name itself, it involves your digestive tract, and there is high eosinophils there, no? So may mga eosinophilic mga eosinophil infiltrates, no? Because again, possible na nabot sila sa intestine, ayan, eosinophilic enteritis. All right? So it's caused again by your animal hookworm pa rin, no? A caninum and A brasiliense. All right? Okay, ayan. So don't forget that. All right, sige. Walay questions? Sige, at proceed na sa last group. Alright? So these are the nematodes sa pangalan na that reside in your blood. Okay? Alright? Aside from blood, they also reside in your lymphatic vessels, lymphatic system, and also subcutaneous tissues. Alright? And these are your filariae. Alright? Your blood nematodes. Alright? Now, your blood nematodes, the adults, ang mga adult worms, they reside in the lymphatic system or tissue, and they produce, again, larvae known as microfilariae that can be found in the blood. Most of your species can be found in the blood of your filarial worms, all right? And your filarial worms, similar, again, with your Dracunculus, Trichinella, they are all larviparous, no? Larvae dahil nila ma-produce, all right? But within the uterus of your female na filarial worm, there could be an egg stage dito, alright? Pero pag gawas niya sa body sa imuhang female, larva na siya agad-agad. So it's considered to be a larviparous pa rin, no? Filarial worms. And the baby or mga larva, they are all known as microfilariae. Now, these microfilariae, they exhibit what we call periodicity. So when we say periodicity, this is a time in the blood na daghan sila. Alright? So it's a parasites are present in the bloodstream during a specific time period. So they are in greatest number at this specific time period sa day, no? Alright, so diurnal, when you say diurnal, they are present in greatest numbers during the day. Nocturnal, during sa gabi. Subperiodic, the occurrences are not clear-cut. Possible na pwedeng daghan siya sa morning, possible na pwede po siya daghan sa evening, so dili na naka-established, alright? And na po non-periodic. So when you say non-periodic, bahalag unsa oras, naaragid sila makitaan. No? Sana all. Bahalag unsa na oras, present lang. Charot. So, bahalag unsa na oras, the worms can still be found in your bloodstream. Okay, that's non-periodic. Okay. Now, two characteristics that we use to distinguish the species among each other. We look at the microfilariae. All right. So later, towards the end of the lecture, mga siguro tomorrow, towards the end of the lecture, atong i-summarize ang mga microfilariae na characteristics. All right. And unsa atong lantawon, the presence of a sheath. All right. Presence of a sheath or distribution of nuclei within the tail. All right. So kana silang duha atong lantawon na characteristics to differentiate the species of filarial worms. Okay, asa nato nalantawon sa ilahang microfilariae, all right, or ilang mga larva, all right? So distribution again of nuclei sa tail and the presence of a sheath. Presence or absence of a sheath. Kaning sheath again is a delicate transparent covering. It's described to be as an egg membrane, all right, na nagstay, all right? Egg membrane that remained no after pag-release, no, after na-release ang larva sa blood, no? So after within the uterus, there could be an egg membrane na form, okay? And this egg membrane, if i-remain siya sa imuhang worm, then that becomes the sheath. Pero if wala, or iyang i-rupture ang egg membrane, then of course, the worm becomes unsheathed. Wala siya sheath, okay? Sheath, ayan, you're a piece of sheath. Charot, joke lang. Okay, ayan. So presence or absence of a sheath and distribution of nuclei within the tail. All right, okay. Now we go now to, again, other information sa filariae. Habitat, very important. Adults, again, makitaan sa lymphatic system. But for loa-loa and onchocerca volvulus, they can be seen in subcutaneous tissues. For microfilariae, they can be found in the blood, except again for onchocerca. So si onchocerca gyud, it can be found in subcutaneous tissues, all right? But for loa-loa, ang adults na makitaan sa subcutaneous tissue, but ang microfilariae, sa mong loa-loa, makitaan sa blood. Okay? All right, sige. Now, final host kay man, intermediate hosts are mga vectors, mga arthropod vectors. No? Pwedeng mosquitoes, most of the time mosquitoes, but aside from that, napay other arthropods, mga flies, no? Ayan, alright, mga flies. Okay. Diagnostic stage are the microfilariae, alright, microfilaria. Infective stage, of course, infective stage to us, to humans, from the vectors are, of course, the filariform larva, alright? But ang atong ihatag sa mga arthropods are, of course, the microfilariae, because the microfilariae, siya ang nasa bloodstream, okay? So siya ang makuha sa mga arthropod vectors, like mosquitoes or flies, okay? And of course, the mode of transmission is through the bite of an infected arthropod or vector, okay? All right. Now, life cycle is very similar. It's common to all members. Ang mo differ lang kay kung kinsa ang vector, kinsa nang magdala, mosquitoes ba or other arthropods. Okay. And again, asa na area sa body ang adults mupuyo. Di ba ang adults ang onchocerca kay sa og lowa-lowa sa subcutaneous tissue. And microfilariae also of onchocerca sa blood. But the rest of your filarial worms, aside from onchocerca, the microfilariae, ilahang larva, makitaan sa blood. Okay? All right, please take note of that. So again, ang makuha nato from the mosquitoes are the L3 larva. Now, inside the body, the L3 larva will then migrate, okay, madala siya sa bloodstream to the lymphatic system, usually lymph vessels, and dito sila mature as adults. Now, the adults, once mature, of course, will mate, all right, and then will produce worms, no, which are your microfilariae. And these microfilariae are deposited in the bloodstream, okay? Migrate, mulihok ang imuhang microfilariae, padulong sa imuhang bloodstream, okay? And these microfilariae, because sila ang naman sa bloodstream, sila na po na makuha balik sa imuhang mosquito, all right, or arthropod vector, and the cycle goes on, all right? Okay. Now, primary mechanisms of filariasis, you have lymphangectasia, all right? Lymphangectasia meaning iyahang i-dilate, iyahang padakon, no? Iyang i-dilate ang lymph vessels kung asa siya mupuyo because of mga preformed saliva that enlarges to accommodate the adults. Alright? So, pag ato sa adults sa imuhang lymphatic vessels or kung asa sila mo mature, nasa saliva na i-release and other substances na para mudako ang imuhang lymphatic vessels, and that is lymphangectasia. Next, you have lymphangiogenesis. Nasa pangalan na genesis, the production of new lymphatic vessels. Because again, para mas ma-accommodate ang more adults, samot na mudaghan sila. Okay. And another important characteristic or important thing to remember, Wolbachia. Please take note. It's an alpha proteobacterium, rickettsia-like organism, para siya rickettsia, that helps, no, in the development and also pathogenesis of filariasis. So inside the bodies of Wuchereria, Brugia, and Onchocerca, they have this bacteria, which is Wolbachia. All right? Your Wolbachia, again, facilitates development, viability, and fertility of these worms, all right? Para mas mupadayon siya o grow, all right? Mo help siya in nourishing the worms para mo mature. Aside from that, it also helps in the pathogenesis, no? Makakause po siya infection or makatawang siya sa filariasis na mas mo progress. Okay. Now, treatment is your Dec. Your Dec, DEC, diethyl carbamazine. Hindi yung iba ha. Naku, sinasabi ko talaga. Alright. And pwede po ivermectin. Naku, si ivermectin lumabas ulit. Naku, di ba? Si ivermectin yun are used for worms. So, why would you use it for a virus? Di ba? My gosh. So, ayan. So, ivermectin and diethyl carbamazine. So here is your Wolbachia. Again, it's rickettsia-like organism. And if you can remember in your bacteria, rickettsia, mga bacteria are intracellular, all right? So they need to live within live cells, all right? So intracellular. So same siya with Wolbachia po. They're intracellular. So inside the adult worms of Wuchereria, Brugia, and Onchocerca, they have this bacteria. Again, that helps in the nourishing, helps in viability, and also in the pathogenesis of filariasis. So sa mga treatment options, aside from diethyl carbamazine, na ibang treatment options na i-partner siya with antibiotic, no, such as tetracyclines and all that. Kaya para maapektuhan po si Wolbachia, okay? And there have been reports na effective siya because again, na may Wolbachia na bacteria, so maigo siya sa imuhang antibiotic, no? So mamatay ang Wolbachia, and di ba, the Wolbachia helps in the viability and nourishment of your worms. So if wala na to siya, so possible na mamatay po ng worms, inana. So may mga treatment options na inana. I-couple ang diethyl carbamazine with an antibiotic. Ayan. Okay. All right. So that's for the initial information about your blood nematodes or filariae. So very important, take note, no, common regular sa tanang species, infective stage, which is your filariform larva, atong makuha from the mosquitoes and arthropods na mga vectors. Aside from that is the mode of transmission, bites of an infected arthropod. Okay, all right, sige. So that's for the important initial information about your blood nematodes. All right, and we'll start first with the first species, your Wuchereria bancrofti or Bancroftii, no? So Wuchereria bancroftii is considered to be the most common among the filarial worms, no? It infects the world, daghang areas in the world, and it's the most common then in the Philippines. All right, ayan. Now, it shows nocturnal periodicity. So, by the name itself, no? Nocturnal periodicity, makita siya sa gabi eh. So, it's best to collect blood during mga time, 9 to 10 p.m. and 2 to 4 a.m. So, one of the ways or one of the importance of your periodicity is that we can know kung what time ta makakuha or what time ta makuha og sample from the patient. Because once makabalutan na, okay, based sa history kan sa Africa or sa areas na endemic ang Wuchereria, then possible that nocturnal periodicity. So sa mga gabi ita mo og blood sample ani na patient. So again, during what time? 10 p.m. to 4 a.m. Ayan, 9 to 10 p.m. or 2 to 4 a.m. So ina na siya. Di ba parang tapos like klase no na siya schedule ganun. Now, majority are nocturnal, no, but there are some worms or some species samot na sa Pacific region that are subperiodic na form. So again, when we say subperiodic, dili klaro iyahang periodicity. So in this case, subperiodic siya in which ang iyahang filarial worms present ra gyud siya all the time pero mas daghan siya sa noon sa 12 p.m. up to 8 p.m. Diba? So it's not established yun na okay, daghan gyud siya sa gabi 10 p.m. to 4 a.m. So subperiodic form, diba? Not clear cut, dili klaro ilahang occurrences, no? So again, in the Pacific region, subperiodic form, daghan na siya all the time, okay? Or present ra ang Microfilaria all the time, pero mas daghan siya kung 12 noon up to 8 p.m. All right? Sige. Now, other name, Bancroft's filarial worm. And your vectors, of course, as you can see, mosquitoes. That's why common siya sa Philippines kaya we have the vectors. No? You have Aedes, Anopheles, and Paniculex. Ayan, so mga female mosquitoes. So mga mosquitoes, yun, daghan yung kaayong possible na mahatag na parasite. So if questionan mo na, which of the following arthropods transmit the most number of parasites, press the buzzer, atong answer kay mosquitoes. Daghan yung kayo mosquitoes, no? Filarial worms, pwede po plasmodium, no? Daghan pa. So, ayan. So, mosquitoes yun usually ang daghang parasites na ma-transmit. Siya ang vector na daghang parasites na ma-transmit. Okay? Alright, that's Wuchereria bancrofti. Alright. Now, for life cycle, ayan. So, similar again siya sa tanan. Again, the mosquito bites us. Alright? And inside the mosquito are the L3 larva. So, ang L3 larva itong makuha. Now, in the L3 larva, once inside the body, alright, migrate siya to the lymphatics. And dito siya mature into adults. And the adults will produce microfilaria, the larva, which are then found in the blood. Alright? And this microfilaria, again, will then be ingested by another mosquito, all right? And inside the mosquito, ang microfilaria will mature into L3 larva, and then the cycle goes on, all right? Basta ang question kay infective stage to man, kita, kung sa answer, filariform larva, L3. But the infective stage to mosquitoes, again, sa itong answer, microfilaria, sorry. All right, sige. So same again sa plasmodium, di ba? Again, infective stage of plasmodium to man, kung sa may makuha na to. Wala, charot. Kung sa may infective stage ng plasmodium to man, ang sa ganito? Sige, nagbalik-balik. Na-remember pa ba? Infective stage of plasmodium to man, meaning na to, kung sa man. And there was silence. Kung sa man? Kung sa itong makuha from mosquitoes, sa plasmodium ha? It's your smile. Charot. Kung sa man? Set infective stage ng plasmodium to man? Your?
Oral.
Okay, ayan, sporozoites. And infective stage to mosquitoes sa plasmodium unsa man? Your? Okay. Unsa may makuha sa mosquitoes gikan nato? It's your smile. Charot. Your letter G, your gametocytes. Okay. Okay, sige ha, dears. Please do not forget that. Siguro wala pa makita sa sporozoa nato na pre-recorded lecture. So sana naman makita niyo na noon sa naman karon. Okay. So yeah. So don't forget that. Very important, plasmodium ha sa malaria, especially sa malaria. All right? So infective stage of plasmodium 2 man nato, ang makuha nato kay sporozoites, tama. But ang atong mahatag sa mosquitoes, all right, or infective stage 2 mosquitoes are your gametocytes. So same here sa filarial worms ha, filarial worms, infective stage 2 man atong makuha is your filariform larva, L3. But ang atong ihatag sa mosquitoes and other arthropod vectors, all right, kay unsa man, your microfilaria. Okay, don't forget. All right, sige. So that's for Wuchereria. Now we go na to symptoms and pathology of your Wuchereria. No, si Wuchereria siya gyud ang makakause og lymphatic filariasis. Now number 1, there could be asymptomatic patients, no, nang daghan na kaayo, no, ang ihang filarial worms pero wala gyapon siya symptoms. Okay? Because it could be that pila pa ka years after pa mogawas ang symptoms, no. So medyo dugay-dugay pa. First of that, ang ihang disease na mga cause is your acute dermatolymphangioadenitis, no. So dermatolymphangioadenitis. So meaning sa skin imuhang presentation, all right? And ma-involve ang mga lymph nodes, all right, and mga lymphatic vessels, all right? So this is the most common acute manifestation. There's localized pain, lymphangitis meaning na-inflame imuhang mga lymphatic vessels, all right? And lymphadenitis, naghubag imuhang mga lymph nodes, all right? Okay. Now, lymphadenitis and lymphangitis usually kay lower extremities, all right? Mas common siya kaysa sa upper extremities. So sa mga tiil usually, or genital involvement, very important. Common ang genital involvement sa Wuchereria bancrofti, no? So, pwede siyang mo-reside sa mga lymphatics near the genital organs, okay? So, common gina sa Wuchereria, all right? And aside from that, pwede po breast involvement, no? Bastos-bastos ni Wuchereria, charot. So, gusto niya ang genital organs, and aside from that, the breast involvement. Now, aside from that, this ADLA is supposed to be, is considered to be not caused by the worms per se, no? Dili gyud siya caused by the worms, but actually it's caused by a secondary infection, usually bacterial ang origin, and usually ang common na makakause ana kay si group A, Streptococcus. All right? So because of maghubag imuhang skin or like imuhang lymph vessels, possible na na-infection na mahitabo, no, sa imuhang skin especially. So secondary bacterial infection is usually caused by group A, Streptococcus, your strep pyogenes. Okay, all right. Nako, bakte, sana naman ready na sa micropara. All right, na kompre. Next, aside from that, it can also cause acute filarial lymphangitis. So this happens when the adult worms die, all right, and can lead to localized inflammation, no? So manghubag imuhang lymphatic vessels and manghubag po imuhang lymph nodes, no? And they can produce a palpable cord. So ma-feel nimo na naimurag cord diri sa imuhang skin kay nang hubag sila ng enlarge, no? Acute filarial lymphangitis. Aside from that, it can cause lymphedema, chronic manifestation, because again, di ba, the vessels are enlarged, magsigi ka og inflamed. So what happens sa mga, immune cells na moadto sa imuhang lymphatic vessels, and it can lead to permeability of your blood vessels. So what happens, mang-leak, no, mugawas ang lymphatic fluid padulong sa imuhang tissues, padulong sa imuhang skin, and it is high in protein, and this high in protein na leakage of fluid possible na ma-affect ang skin, which can lead to thickening and verrucous changes in the skin, which is resembling the appearance of an elephant, no, feet. That's why it's called elephantiasis. All right? So here's a picture, diba? So you can see verrucous, diba? Very thick, murag na yung mga scales or crust, iyahang skin. All right? And dagko, enlarged. Because again, of edema, nang gawas na mga lymphatic fluids, nang hubag yung mga lymphatic vessels, so mudako po imuhang extremities. All right? Similar again to the feet of your elephants, diba? Elephant appearance. That's why it's also called elephantiasis. All right? Okay, that's for lymphedema. All right. Now, aside from that, because we have mentioned that your, sorry naman ha, pasensya sa mga picture dyan, baka ano kayo, charot. So because again, your adult worms of Wuchereria like to reside also in genital lymphatics. So if dito sa genital lymphatics, ma-obstruct ang genital lymphatics, all right? Ma-express ang mga lymph fluid to the surrounding tissues, it could lead to hydrocele, all right? Which is a fluid-filled sac sa scrotum, all right? And lymphatics also near the kidneys, if mo rupture sila because of too much worms or enlarged na kayo sila, the lymph will be expressed into the urine causing chyluria or milky urine. Ayan. So here's an example, di ba? Hydrocele, nang hubag imong scrotum, all right? Because again of lymphedema din dyan, and then mga worms na nasa lymphatics duol sa scrotum, no? So mo enlarge, mudako po imong scrotum, and this is hydrocele. And then aside from that, chyluria, milky urine. All right. Ayan. Sige. Next, you have your tropical pulmonary eosinophilia or Weingarten's syndrome. This is an allergic reaction actually, or it's occult filariasis. So when we say occult, it's hidden, no? There is filariasis, pero wala kayo nakitang microfilaria sa blood. All right? Okay. Now, tropical pulmonary eosinophilia, again, nasa pangalan na, pulmonary infiltrates, all right? Peripheral eosinophilia, cough, systemic attack, asthmatic attacks, and it's usually found in patients na endemic, no? Or found in patients that have been living in endemic regions for the longest time, no? So, if ikaw, sige kang, if na ka nagpuyo ani na area, niya endemic siya for filarial worms, so magsige na kag-expose, no? Magsige kag-expose to the larva. So, what happens could be is that the microfilaria can be found or can migrate to the pulmonary capillaries sa lungs, all right? So it can cause tropical pulmonary eosinophilia. So it will present as para mga asthma, no, allergic reactions, and also inflammation then. All right. And there is eosinophilia. All right. Okay. Another one is Meyers-Cuminar syndrome. It's still an occult filariasis actually. Occult filariasis yapon. The microfilaria are found in the spleen, liver, and lymph node that leads to hepatosplenomegaly and lymphadenopathy. All right. So dagan siyang possible na presentation. But ang pinaka-common good dears, please take note again, are your filariasis, no? Acute lymphatic filariasis, elephantiasis, yes, don't forget, lymphedema, chronic manifestations, hydrocele, ayan, and chyluria. And of course, TPE, tropical pulmonary eosinophilia. And TPE, again, is common among patients that are residing in endemic regions for the longest time. Kung dugay na gid ka nagpuyo dito. All right? Okay, ayan. So that's for the symptoms and pathology of your Wuchereria bancrofti. Now, for lab DX, of course, the main mode nato is, again, thick and thin films, no? Thick and thin films, we stain it with GEMSA. Now, because again, your microfilariae are large, they are worms naman. So we have to examine at the sides of your thin films, no? Sa thin films, atong latawan ang sides. Because again, possible na dito na concentrate imuhang worms. Pag pull nimo sa imuhang smear, di ba? So we have to look at the sides over entire smear gyud because again, the worms could be there. All right? Okay, and of course, Knott's concentration technique, please take note, no? Usually seen in patients or usually done in low number of microfilaremia or low number of microfilariae. Ayan. So 1 ml of blood, pwedeng EDTA, pwede pong heparinize, but usually EDTA. EDTA blood, 10 ml of 2% formalin, you centrifuge at 500 G for 1 minute, and then we stain with GEMSA. So concentration methods, diba? Similar with your stool concentration techniques. Nucleopore filtration method, na-mention na nato ni sa ang first, di ba? First lecture jud nato, all right? So ato ipaagi ang blood sa usa ka filter, all right? I-lyse ang mga RBCs after para ang mabili na lang kay mga worms, all right? And then we examine the filter under the microscope, pwede nato siya i-stain, all right? And then examine under the microscope, all right? You have another test, your Dec Provocation Test, your Dec Provocation Test. So the patient is kanang given ato siyang paimnon og DEC, all right? And what happens is the DEC will induce na mugawas ang worms bahalag dili gabi kay nocturnal periodicity man ni siya. So ganahan siya bahalag dili gabi mugawas ang worm kay ma-trigger siya sa DEC. Ayan. And then we collect samples sa blood and then examine 15 minutes to 1 hour after administration of DEC. All right. Now you have serologic methods, you have limited value lang, antigen detection, immunochromatographic methods, PCR amplification, and you have ultrasonography. We can detect the adult worms, of course, in the lymphatic vessels, no, or in the lymph nodes, all right? And in the ultrasonography, we can see this Filaria dance sign, all right, which is a pattern of movement by the worms that is described as rapid and random, okay? So please take note, Filaria dance sign. So, siya ga-dance, okay? All right, ayan, sige. So that's for Wuchereria bancrofti, okay? So again, sa end of the lecture na, tomorrow, ang pag-describe sa microfilariae. So don't forget. Don't worry. All right? Natin mga mnemonics there. So don't worry. Okay? All right. So muna siya mga methods for Wuchereria bancrofti. Okay. Next, we go now to Brugia malayi. So Brugia malayi is again another filarial worm, no? That is similar with your Wuchereria bancrofti. Again, nocturnal periodicity, but please take note that iyahang sheath, okay? Iyahang sheath kay mas stain siya with GEMSA. Okay? So it stains with GEMSA, iyahang sheath. All right? So sheathed niya siya. All right. Now, other name, it's Malayan filarial worm or Brubian Filariasis. The vectors are still mosquitoes, no? Aedes, Anopheles, and Mansonia, if nocturnal siya. And we have also a subperiodic form similar to Wuchereria, and ang iyahang vector ana is Coquiletidia. All right? So muna siya subperiodic form na vector ni Brugia malayi. Okay. Now, symptoms and pathology similar gapon with Wuchereria bancrofti. Lymphangitis and filarial abscesses mas daghang mahitabo or occurs with a greater frequency than Wuchereria. Aside from that, very important, walay involvement sa imuhang urogenital system. And chyluria does not occur. All right? And chronic lymphedema and elephantiasis also is not frequent. Okay? It does not occur frequently. So muna siya one of the distinct features na differences sa Wuchereria and Brugia. Ang Wuchereria, common yun ang genital involvement. But for Brugia, walay genital involvement. So walay hydrocele, walay chyluria. Okay, all right. Now, clinical disease, mas paspas than your Wuchereria bancrofti. And another very important characteristic of Brugia malayi, there have been cases of zoonotic infections, meaning nakuha siya from animals, no? And usually nakita siya in cases sa America, sa North America, no? Na yung mga nakuhang infections from animals, zoonotic infections, okay? So another distinct difference from Wuchereria, all right? Na zoonotic infections, okay? All right, sige. So that's for Brugia malayi. Same Ragapog life cycle, different lang kayong vectors, all right? And then another species is your Brugia timori. Your Brugia timori is another species of Brugia, pero similar gapon siya og appearance, similar siya og symptoms or pathology with your Brugia malayi. It shows nocturnal periodicity pa rin, and the vector is Anopheles mosquitoes. Morphologically similar with your B malayi, but the difference lang is that it tends to be longer, okay? And the sheath does not stain with GEMSA, okay? Unlike your Brugia malayi na the sheath, kani, it stains with GEMSA, color pink. Your Brugia timori, dili ma-stain iyahang sheath, okay? Infections, again, similar to Wuchereria, bancrofti, and Brugia malayi, but mas daghang abscess, no? Mas daghang mga nana, daghang mga hubag-hubag. Ayan, for Brugia timori. Diagnosis for both species is still similar, no? Similar with Wuchereria bancrofti na mga methods. So, thick and thin films, your DEC provocation test, no? Knots concentration technique, and the rest. Okay. All right. Ayan. Now we go now to the difference of the two, Wuchereria bancrofti and Brugia malayi. So we look at movement, okay? Graceful or smooth imuhang Wuchereria bancrofti. So smooth yung appearance or yung movement. Brugia malayi kay kinky or stiff. So medyo gahi yung lawas. So dili siya dancer, charot. For nuclei, Wuchereria is not overlapping. For Brugia kay overlapping. The sheath, again, both of them are sheathed, all right? But the terminal nuclei, dira sila mag-differ. Ang Wuchereria, no terminal nuclei, meaning sa end sa ihang tail, walay nuclei dito. Ang Brugia malayi ay duha ka terminal nuclei. And there's a bulge, bulge around the nuclei. So, naimurag hubag around the duha ka nuclei. So, ayan. So, terminal nuclei atong gilantaw, di ba? As we have mentioned, we look at the nuclei sa tail and the presence of a sheath or the absence of a sheath. Now, for Wuchereria, no terminal nuclei. So, atong mnemonic for the kay Wuchereria, di ba? Wuchereria, wala. Guess our mnemonics, Wuchereria, wala na nuclei. Walang nuclei. Okay? So, Wuchereria, ako na lang i-write. Wuchereria, atong mnemonic kay wala. So, Wuchereria, ayan, Wuchereria, wala ni siya dapat. Pero wala na walang nuclei. And then for Brugia, di ba letter B? Letter B ang Brugia, di ba? So, unsa man na unsa man na number sa alphabet ang letter B? Ika-second. So, meaning, nasa duha ka terminal nuclei, alright? Nasa duha ka nuclei sa tip siyang tail, and there is a bulge around the two nuclei. Please take note ha, atong mga mnemonics. So, Wuchereria, wala siyang nuclei. Alright, sa tip. And you have Brugia, B, letter B. You have 2, di ba? B is the second letter in the alphabet. 2, duha ka terminal nuclei. Alright? Okay. And aside from that, there's a note here. Elephantiasis below the knee, Brugia malayi. Alright? And elephantiasis above the knee, Wuchereria bancrofti. Please take note. So, below the knee, if na kay mga elephantiasis there, it's caused by Brugia. And for Wuchereria, above the knee, because it can involve the genital lymphatics. Okay? Alright, sige. So, that's for the first three na mga filarial worms. Alright. And the last filarial worm for today is your loa. Ayan. Now, loa, alright, is again another filarial worm. And this time, it exhibits diurnal periodicity. So, during midday hours, usually sa noon, 12 p.m., up to 2 in the afternoon. Alright. And the sheath, similar with your Brugia timori, it does not stain with GEMSA. Now, take note, other name is known as your African eyeworm. Okay. And the vectors, different na, it uses your Chrysops spp. Chrysops is also known as your fruit fly, mango fly, tabanid fly, or deer fly. Please take note. So, ang life cycle is the same regular with Wuchereria and Brugia, but the difference lang is the adults of loa, they reside as ganito sa subcutaneous tissues instead of the lymphatics. Okay? But ang microfilaria sa loa, makitaan sa blood. Okay? But again, ang adults lang different. Okay? The adult worms live in the subcutaneous tissues. Okay? All right. Now, for symptoms and pathology, after mamaak ang Chrysops, okay, of course, there's erythema, magkatol, and swelling. And migrate ng sugod ang larva sa subcutaneous tissue. Alright? And in the subcutaneous tissue, of course, dito na sila mature. And in the subcutaneous tissue, pag migrate nila, it causes your calabar or fugitive swellings in ani. So your calabar or fugitive swellings are mga localized edema, alright? Because of inflammation kaya sa pag-migrate sa imuhang worm. And usually, pwede po allergic reactions because of the metabolic products produced by the worm. So it may be found anywhere in the body, but it can be seen on the extremities most of the time, or usually sa mga eyes, okay? Now, serious complications can include cardiomyopathy, pwede siya maabot sa heart, pwede sa brain, encephalopathy, nephropathy, and even sa lungs, ang imuhang loa. Alright. Okay. Now, for definitive diagnosis, again, the microfilaria, since makita man siya sa imuhang blood, so same methods gyapon with Wuchereria and Brugia. Ang definitive diagnosis is the identification or the removal of the worm from the eye. Because again, pag migrate niya, di ba, sa adults, subcutaneous tissue, pwedeng maabot siya sa eyes. So, makita na worm nagalihok sa imong eyes. Okay? And makuha na to siya. Surgical removal, definitive diagnosis. Identification of the worm in the eye, in the tissue, or sa peripheral blood. ang lowa-lowa. Alright? Okay, but most of the times mga tissues, because again, sa subcutaneous tissues siya makita ang adults. Alright. Now, treatment, surgical removal of the worms, and aside from that, of course, Dec, DEC, albendazole, or pwede po ivermectin. Because again, it can reach the brain. There have been cases na na-reaches the brain, so that's very deadly. It can be life-threatening also. Alright? But it's not really common din naman. Very rare lang siya. Alright? So, usually, ang ma-involve ra mga subcutaneous tissues. Alright? Calabar swelling, kato. Manghubag ang usually ang mga mata. Alright? Or extremities. Because of inflammation, allergic reactions from metabolites of the worms, and the migration pod of the larva. Okay? Alright, please take note. Again, subcutaneous tissues siyang adults, but the microfilariae can be found in the blood. Alright? Please take note. So, yes, that's for lowa-lowa. Again, it's a vector, Chrysops spp, your deer fly, mango fly, fruit fly, tabanid fly, alright? And common name, African eyeworm. Because again, common siya in Africa, and usually, it was first found from a girl na eyeworm na nakitaan siyang mata. Okay? And this worm is the migrating adult, padulong sa subcutaneous tissues, nabot siya sa imuhang eye. Alright? Okay. And that's all for today. Tomorrow we'll continue for your filarial worms. We're almost done again with nematodes. Alright? Before we end, any questions, dears, before we end?